title of it is Assessment of Accuracy of an Imageless Handheld Robotic System in Component Positioning in Total Knee Replacement. We use the Navio 6 software. Purpose of the study was to assess the accuracy of the Navio system in component positioning. As we know, we've got 6 degrees of freedom in the knee: the varus, valgus, rotation, internal, external, and the flexion extension. Whatever parameters we choose, whatever philosophy we choose to align our implants, the accuracy of the robot in achieving what we've planned will eventually determine the component positioning, and that eventually will determine the clinical outcomes. So the materials and method study period was from August 2018 to May 2019. A sample size of 62 patients were prospectively enrolled. Parameters measured were the femoral coronal alignment, femoral sagittal alignment, femoral rotation alignment, tibia coronal alignment, tibial sagittal alignment, and the mechanical axis. Planned and achieved values were collected from the Navio logs of all the above parameters. Paired t-test was done to compare the planned and the achieved values. Level of statistical significance was set at p less than 0.05, and root mean squared error was calculated for all pairs of planned and achieved values. This is our result table. The negative values suggest the valgus, external rotation, femoral flexion, and tibia slope. As we can see, the mechanical axis deviations in the planned and achieved values for all the 6 parameters that we measured, the p value was 0.89, 0.36, 0.1, 0.91, 0.81, and 0.3. So there was no statistical significance even if there was a difference in the planned value and the achieved value. So this kind of tells us about the accuracy of the robot itself, kept apart the clinical outcomes and the radiological parameters. In the discussion, we all know we've gone through an extensive discussion over the last 1.5 days that how important it is for us to align our components to not be within the beyond the range of outliers, that is more than 3 degree of malalignment. And there are multitude of studies that have shown that when we have more than 3 degree of malalignment, the long-term outcomes are affected clinically. I have included certain few studies that back the outliers and the clinical outcome. The limitations of my study were that pre-operatively or post-operatively the radiological parameters were not assessed, functional outcomes were not assessed. All surgeries were performed by senior surgeon who was previously experienced with navigational technology. So the same results cannot be reciprocated by a younger and a newer learning surgeon, because there's a learning curve to understanding the application of the robot to the total knee replacement. Although the philosophy remains the same, it's just the execution of it. And bilateral single stage surgeries were not included as a part of our study. Thank you. The study demonstrated that semi-autonomous handheld robotic system Navio for total knee arthroplasty produced accurate component positioning as per plan in all planes.